Alright, hi everyone, Dr. Saurabh here. So let us see the explanations of quiz which was on cataract surgeries. The first question is regarding a cataract surgery in which the entire lens is taken out by rupturing the zonules. So the only option in which this is possible is, as the name suggests, along with the capsule the lens is taken out by rupturing the zonules. It will be ICCE, intracapsular. That is, you take out the entire lens along with the capsule, along with the zonules are broken, and then it can be taken out. In extracapsular means the posterior capsule is left behind. So phacoemulsification, ECC, SICS are extracapsular cataract surgeries. ICC is the answer. So these are the steps of phacoemulsification. A is anterior capsular excess. Circular curvilinear capsular excess is there. This is a red glow picture. A real picture of trypan blue dye is used during this, that can also be shown. B is hydrodissection. C is phacoemulsification, that is chopping of the nucleuses into small pieces by, the answer is this, piezoelectric crystals, conversion of electrical into mechanical energy. One example is lead zirconate. And D is intraocular lens implantation. So C is the answer in which the nucleus is broken down. Phaco means lens and emulsify into small pieces by electrical converted to mechanical energy with the help of piezoelectric crystals. That is the answer. Now, trypan blue dye is used in capsular excess. I just told you it is an inert. That's what is used, and it is washed. You have to wash it out. It can damage the endothelium of the cornea. That's why before trypan blue dye, air is also put. So viscoelastics are put. They are inert. That's why they are used, but they are not left. If you are leaving the viscoelastic, it will cause high pressures after cataract surgery, so it is removed. And some examples of viscoelastics are D option, that is correct. Now foldable sorry, the spelling is wrong. Intraocular lens material, polymethyl methacrylate is non-foldable. Acrylic hydrogel silicone are foldable intraocular lens. This is a factual question, but you should know this. Now many students must have answered the question SRK formula. That is a formula, not the method. The method is biometry. Formula is A minus 2.5 L minus 0.9 K, where L is the axial length measured by ultrasound A scan. K is keratometry, that is corneal curvature. So biometry includes keratometry and A scan. Now this looks like a posterior chamber intraocular lens like an inverted S, but you can see the two holes. Now that is for fixating of the intraocular lens to the sclera. So if there is a posterior capsule rupture, or if there is a aphakia patient, you can put it behind the iris but fixed to the sclera with the help of these holes. That's why this is not posterior chamber, this is scleral fixated intraocular lens. Toric has 6 dots. Dots are there for the axis of astigmatism. Always remember, toric word is for astigmatism. And anterior intraocular lens are double haptics, like claw lens. Now, out of the steps of phacoemulsification, the last paracentesis is the first step, that is incision into antechamber. Then you put viscoelastic to maintain the antechamber. Then you do intercapsular excess. Then hydro dissection is putting the hydro cannula under the capsule to separate it from the posterior capsule, separate the lens from the posterior capsule. Not to separate the nucleus from cortex or the epinucleus from the main central cortex is hydrodelineation. Then phacoemulsification is done by, I told you, piezoelectric crystals. Lens is aspirated, cortex nucleus both are aspirated with the help of phaco probe. Then you put viscoelastic, you do intraocular lens implantation, you take out the viscoelastic, then hydrate the wounds. That is the last. So which of the following is the last is of course hydration of the wounds. You don't suture in phacoemulsification because the size is very small. The phaco probe size is 2.75 to 3.2, that is the size. Now minimum invasive cataract surgery can be done by 1.8 millimeters phaco probe. Now step I just told you, which separate the lens of the eye into outer shell and central mass, is not hydrodissection, that is separation of the lens from the capsule. This is hydrodelination step. That's 8 questions. Many have done 8 out of 8 and very happy for that. 6 out of 8 was okay for this test. Thanks for listening. Best wishes.